open defecation is an important health issue. I recall that about 6 years ago, that should be 2019, thereabout, UNICEF rated Kogi first in open defecation. That was 6 years ago. I'm not too sure. Solomon will bail me out later if Kogi is still retaining that award. However, award or no award, the issue of open defecation is still staring us in the face. Some are emergency situations, while some are what some persons just grew up to know about. But within urban areas, we still have serious issues pertaining to open defecation, and it poses a lot of health risk to residents. But whether we know about the challenges and the risk or not, it seems as if people can't just stop defecating in open places, regardless of the risk posed to their health and survival. What are the factors responsible or that promotes open defecation within our communities, be it urban or suburban areas? And what can be done to curb this menace, either from the government or from non-state actors? Solomon, I know you have some experience on water, sanitation, hygiene issues. I want you to open up on activities of non-state actors and where we are in Kogi State at the moment.
All right, thank you very much. Open defecation has been a serious challenge to the public, to individuals, starting from especially children, families, communities. So the government and private individuals have tried so much to see how they can curtail this. And one of the approach has been the water, sanitation, and hygiene, because it's critical to public health. When you talk about water, we talk about access to water, clean water. Yes, people have access to clean water for domestic use. Then you talk about sanitation, clean the environment, ensuring that the environment is clean. Then you talk about the hygiene, those are behaviors, wash your hands and all that. So all this boils to infrastructure, because if there are no infrastructure to use, people will have no choice than to continue the open defecation practice that we are trying to leave. So that's why the Kogi State government in 2022 is an interesting year for Kogi, because a lot of projects started, a lot of ideas and policies, because you need to criminalize certain behavior before you now say this thing is prohibited.
Okay.
So in 2022, the state enacted a law, environmental health law. The aspect of the law is saying is that every public building ought to have a toilet. So filling stations, shopping malls, markets, schools, yes, even like this kind of town halls that usually we have in our communities ought to have a toilet facility that individuals can use. So that's one of the first approach. But of course, they started with sensitization, sensitizing the public and all that. That same year, in September 2022, we started piloting an idea. The primary healthcare, Kogi State Primary Healthcare Development Agency brought the idea of, they call them CHIPS agents. That is community health influencers, promoters, and services. So we are piloting 4 local governments, Basa local government, Ukene, Yagba West, and one other, I think Ida. Yes. So I personally even participated with them to see some of these challenges. So we went on outreach, understudied what they do. And the feedback is that one of the challenges, access to water, then 2, the infrastructure, because people are ready to clean the environment when they constantly hear this information from people, and the danger open defecation cause in the environment, but also they need to have access to water for this to be achievable. Of course, 2025 is even the year that the Nigerian government pledged to phase out open defecation. Yes. So now we're asking the question will now be: is it achievable? Are we able to build those toilets, the amount of toilets we need? That as of 2024, we're told that 23% of Nigerian population still practice open defecation, and we need about 7 million toilets. Wow. So how many toilets have we built so far?
Now, before you tie this up, you failed to tell us if Kogi is still retaining the award.
Oh no, we have done a lot, and we're no longer. We are still in top 5, which is sad, but we're no longer the number 1 in Nigeria
when it comes to open defecation.
Open defecation
Now,
yes.
Oiza, he mentioned that there's a law in place in Kogi prohibiting open defecation. How practicable is this? Is it workable, looking at the complexity and the realities on ground across the state?
Okay, before I answer that question, you said something. You said it's like people can't just stop practicing that. And I don't think people can't just stop practicing it. I think now I'm merging it with the question you just asked. If you're going to enact a law, there must be a provision. When the provision is there and people fail to use what you've provided, then the law can take its course. Now, you said 23%, yes. And I think it's higher than that. Much higher than that. Because most shops don't have toilet facility. Most motor parks, if not all. I think we have one mega motor park in Lokoja, international. What do you call it? Filele Park, and I'm not sure they have a functional. Okay, they have.
Yeah, they do have. But there is still open defecation is still ongoing
there
on a high rate there.
Over there, then we have other at Natako axis. If you go up there, I don't think there's and then we have what they call it, public schools. I don't know if they have toilet facility. Then we have buildings, residential buildings that they don't even have. Maybe one will cover for so many people. Then churches, you mentioned churches. Most churches don't have. Then I don't know how. I think it's feasible if the government put in place, even if it is mobile toilets. I think there was a particular year that the idea of mobile toilet came up, where I saw so many of them green in color for people to use, and people were even saying, okay, if you even want to charge people, even if it is 20 naira, or then you can, if you want to charge people as low as 20 naira or 15 naira to make use of this space, so that we can get someone to maintain. The money you are paying is for maintenance. It's not as if you are paying to use the toilet, but for people to be able to maintain it for hygiene, so that other people can use it. But before I know what we can't, I don't know. I've not been seeing those mobile toilets.
This point you just made. Sorry, I just want to quickly come in. This point you just made has been what's been playing on my mind since we started this discussion. This issue of provision of mobile toilets. And then you mentioned government. That is where a lot of people's minds are, their thoughts are there, that government should provide mobile toilets. But I'm thinking differently. This is a business opportunity for some persons. As an entrepreneur, if you can come up with facilities for, mobile toilet, even if it is not mobile, like you build a facility in strategic areas, it's like the markets she mentioned, motor parks and other such strategic areas of the town. People are passing by every day. People pass. In fact, I'm not sure there is a particular statistics that will tell you the actual number of cars that pass through Lokoja on a daily basis. It is an opportunity if, some persons can come up with the resources to do that. I can use the example of yes,
DMT mobile toilet.
yes. That is something I don't know.
But his business then, I think it's late now.
Yes.
His business was DMT mobile toilet, and he used to pride himself as a shit business owner.
Mhm.
And he will tell you that shit business is serious business. He ran it successfully, making good fortune from mobile toilets, but discovered that bulk of the toilets end up in events, social events,
Yes.
not just in public places.
Yes.
Yeah, you have an international event coming up at Eagle Square, International Conference Center, Murtala Confluence Stadium.
Yes.
He will deploy mobile toilets
Toilet, yeah.
together with the organizers. Some of these monies come from organizers, and then some come from maybe direct billing of people that want to use the facility because of the large crowd of people that will come around. Because when you have events like that, even if you have normal restrooms within the facility, they will not be enough for the crowd that will come in. Imagine our normal presidential campaign or governorship campaign that when we normally host them at the Conference Stadium in Lokoja. Look at the large crowd. Even though there are toilet facilities within the stadium,
Won't be enough.
it cannot serve the large crowd. So at the end of the day, they just move around the main bowl, the bushes around the main bowl, and mess the whole place.
For example, you see, the first time this ultra modern Muhammad Buhari Square, the first time it was used for a public event, a national Maulud was organized in Lokoja, and that space was given to the organizers to use. You need to go and see the place the following morning, the way everywhere was messed up.
Yeah.
I don't think we have something like that
in place.
It would have gone a long way in mitigating the effect of.
The question Ofe asked me was that is it
the law?
Is it feasible?
Is it practicable?
Now I was talking when you made an input. That Muhammadu Buhari Square you talked about, assuming the government, when you're building such facility, I think toilets should be part of the plan.
It was and it is.
And it is.
Is it functional?
Yes.
I think
is it functional?
No, it is functional because I've used one of their toilets even as early as last week.
You said the place was messed up.
No, the place was because of the crowd. The toilet facilities there were not enough.
So we need something like mobile toilet around
for a place
to augment.
Yes.
A hospital in Lokoja here. If you go there and you're admitted in government hospital, not state anyway, but Federal Medical Center, if you go there and you're admitted in that hospital, you may end up carrying something else, because if you are, the day we drove in, me, you, and who, I think, Corridor, once you drive straight and you see the mess in that place, you have to ask yourself again, am I in a hospital or in a, is it latrine or something, a different space entirely? A hospital where people pay for services. Cannot provide hospital. I'm particular about that particular name, the name hospital, where they're supposed to cure illnesses, take care of your health, cannot provide sufficient. They will tell you they have one or two sufficient or adequate toilet facilities for the
for their patients
and even
other-
visitors.
other visitors.
Other
Yeah.
visitors. You
Yes.
see people that are sick, they'll have to buy their own potty. If you can't
Mhm.
move out to look for where to do your business, you have
Yes.
to get your own potty
Potty,
so that you
yeah.
can use, and maybe someone sitting with you will
Dispose it.
they help you to
To
hospital.
dispose it where?
Where?
Yes.
Looking at the location of the hospital. Where?
Where?
You understand my point? Now let's go into
You even
this.
want to ease yourself, you have to look for a space.
I love this some of
to
these
do
practical
Examples.
scenarios we are
Mm.
painting. Now, number one thing, let me say this: shit is no respecter of persons.
Nobody.
It's no respecter of gender.
Mm-mm.
Whether you're a big man or you are a small man,
Once
you're a
it
big
hook you
woman, it can hook you, and
anywhere.
it doesn't give warning signals. It has happened to me
Can
before.
come anytime.
You understand my point now? I was in a church. Morning service, not night service. If it were to be a night service, now it would have been better. You understand? Under the cover of darkness, I would have been able. I can do it. I can defecate openly somewhere, no codedly. But it was normal morning service, and there was no restroom. And I had my bowel movement was there was an uproar with my bowels, and I know fully whether I can't rush home.
A distance.
Looking at the distance,
Mm.
I cannot wait till the end of the service.
Service.
I just have to look for a small open place where I can get little cover,
And you lose your
And
you lose your
and I have to free myself from the bondage, and I felt relieved. So I also contributed to open defecation, right? That's why I mentioned initially that some are emergency open defecation, why some are normal
becomes a
day-to-day
norm.
Yeah.
Becomes a
thing.
norm in that environment.
Look at drainages too across even urban centers.
Urban centers, yes.
They are become
Filled.
toilets. Sort of.
Filled up.
Villages, we can spare them somehow because they have large expanse of bush areas where they defecate
You can do
openly, and eventually maybe some of them convert it to manure for farming. I don't know how to do that. However, they are still covered in this menace. We are looking at a law in place mandating that every structure, no matter how small, public and private,
Carries
must
a
have
toilet.
toilets.
Functional.
Functional toilet.
Functional
And I'm
toilets.
sure that the sensitization has not been well done, because we still see people building shops,
Without toilet
Schools.
facility.
public places, markets
Yes.
without convenience. So without this, open defecation will still continue. You will still talk more about the hazard, maybe shed more light on the risk involved in that attached to open defecation. But you discover that, practically speaking, whether we like it or not, open defecation is something we have to deal with. You may not think it's important because probably in your house you have a good toilet. In your office you have a good toilet. Most of the places you go to, eateries where you normally eat, they have good toilets, right? Imagine this, that some of your neighbors don't have toilets and they come to defecate around your own house, your business premises, or your residential area every night. How will you feel when you wake up in the morning? I'm not sure you'll be happy with your neighbors for doing that. I don't know if you get my point now. So
There's something we're leaving out. I think toilet facilities cannot function without good water facility too.
if water is not flowing regularly, there's no way you can
Yes.
maintain and sustain
They
toilets.
cannot do that because in fairness to I made mention of Federal Medical Center just now. In fairness to them too, I think the toilets, they will tell you that they'll fetch water in a big tank, and according to them, they say some people will choose to waste it. But if the water is flowing continuously, I think it also helps. Water and convenience they work hand in hand. They can't work in isolation. Yes.
Water
They are
and
all together,
sanitation.
water,
Sanitation and
hygiene.
So we can't talk about
So you talk about
convenience
hygiene, you talk about
Water.
without water.
water. And those
Well,
that's
let's
that's
provide the
what
toilets
is
first.
No, before you talk of water and its place in mitigating
Open
this
defecation.
issue of open defecation, I want to take us back to before, when you see two grown up Lokoja people sometimes quarreling or arguing, the first thing the other person will tell the person he's having the argument or interaction with is that you can't tell me you drank this shit water than I did. And no,
Mhm.
it is like, it is a literal something. It is not like a figurative use of the word. It is literal because when we were much younger, while growing up, you go to the river where you bathe. You bathe there, you drink the water, and then you use
You cook.
to do other domestic chores. You used to wash your clothes and all. In fact, sometimes it got to a point that some persons would have to tell the sheets that are surrounding the top of water to excuse them to get some
For domestic use.
for domestic use. Yes. They will just use their basins and
So
shift
push it.
them
So good. Sieve it.
before they fetch to the house. Now, this is to tell you that this is the foundation we are coming from
Yeah.
as a people.
Mm.
And the fact that it is still in practice in some parts of the state capital is because of that background. And the fact that you talked about some people's houses being littered by other people's feces. It is because of the way these houses are built. Now, these are places where where you
Let me
can.
cut you. If we have water in such area, running water,
Steady
Steady
running
tap
water.
water.
Yeah.
do you think they'll still choose the other option because that is what they are used to?
No, they will not. But there are places where you can stretch your hand and get water to flush. You can just stretch your hand, literally, get water.
Get water
and
from where now?
flush. Get water from the river because the river is close to. And do you know the
And
irony of
flush.
this whole
No,
thing?
you talk
There were
about-
houses.
you
There
talk
were
about
houses
drinking-
where you see maybe there is no running water in the tap, but you have small wells built in those houses. Sometimes it has to do with maybe some cultures, some
Yes, there's
persons.
aspect of culture.
Yes,
There are places you go to, they'll tell you that they prefer the outside, the natural way of doing it. That's the comfort and cultural belief around it.
Can you
Then
talk about
too-
the hazard that comes with it? The
Yes.
hazard that comes with that.
Yes,
Such
I'll talk about
practices.
the hazard. But I want to look at some of the components, how we mitigate some of these things, and areas we have done some research. If you use behavioral change approach also, talk to people, show them example, like Ward E in Lokoja, Ward D and Ward B. In 2022, we also did a kind of pilot project there. Someone from individuals, just group of people came together and brought resources. So what we did was we used the environmental economic approach of giving incentives. So you clean the environment, you stop open defecation. In these 3 words, we'll give you seeds that you can build a garden around your house. Those who were doing complying, we give them more seed. Then those who did very well, we put them on rotational loans services. So the people who were complying, you are interacting with them, you are giving them something, they give you more attention and they see the effect. Some of these things, they can even turn it to decompose it and turn it to manure. But the thing is controlling it, because that's where the issue comes in. You can defecate in the bush and think, okay, I've done it very far. Water will wash it into the environment and people pick it. That's where this outbreak comes. Cholera, this common one that kills children, diarrhea. As common as it is, as at last week, from the research we have seen, out of 35 children that are affected with diarrhea, 1 dies out of 35. You understand? And this can vary from different environments. So it's not something we can just neglect like that. Until recently, even when we were talking about this, in some of the primary health cares in our communities don't even have toilets. Until this Odudo's administration started upgrading some facilities. Because I've gone around to do some monitoring activities. You see, those one, they're upgrading one, now they have toilet. Then have, what's it called? Quarter, staff quarter. At least someone is around there maintaining these facilities. So we have done advocacies. We have joined the government to do a lot of activities around sanitation in this state. Even this mobile toilet we are talking about, I knew when they provided some around Army Signal then, and we were questioning why that location alone, as at that time, why not extend it to area that we know have this high burden of these activities? So let's push it there. We partner, we come with different approaches. So while the government is penalizing people, educating them, we also join educating and bring incentives, not giving them money per se, but there are creative incentives we can bring that will make people listen, and you see these behavioral changes that will even correct those who are lazy about it, those who believe in their culture. Your state have proven it. Those who believe so much in their culture, and today they start open defecation. Then, most importantly, provide the infrastructures. Then the water should be there. The toilets also should be there. Then those who are not complying, when you start arresting 2, 3, 4 persons, other people comply. If I want to give my hands today, I'll make sure that not just toilet, but the one that is suitable and can be used. You understand?
I think it is because of advocacies such as your own that the Kogi State Community and Social Development Agency is able to provide some, public toilets in some areas of these wards you just mentioned. For instance, my ward B, in fact, my area in Cantonment, CSD was able to provide a public toilet which is currently being used and being maintained by the people of the community. And I think such gestures, if extended to other areas, for instance, area like Kabawa, area like Serkinoma, if such facilities are provided, it will go a long way to address this issue of open defecation, I'm sure.
Thank you, Yabagi, for that remark. So, and I want to appreciate the non-state actors, your efforts, the advocacy, sensitization, and the outputs that are visible all across the state. And also, let me commend the state government and other stakeholders that Kogi is no longer number one when it comes to open defecation in Nigeria. However, we are not far from number one, which means we still have a long way to go in addressing this important health and hygiene issue. So we were still calling on government and other non-state actors to step up the game to ensure strict compliance with the existing law and also advise people when you are building a one shop or one room apartment, there should be a restaurant, there should be toilet facility, and ensure continuous source of water, supply of water, clean water, so that the toilets can be well maintained. And based on what you said about public events, each public event, yes, you have built a public facility, a town hall, a normal hall, marketplace, but when you are expecting large crowds, you know fully well that the facilities will be overwhelmed. So why not begin to introduce mobile toilets, or so that they are not permanent there? Let's always make alternative arrangements for facilities that will likely be overwhelmed during certain public events. And I think Kogi State will be better for that. I'm looking forward to a time when I will read in the news that the same UNICEF will let Kogi 36 out of 36, not first, when it comes to open defecation. Thank you very much.
We want to see that the environmental law is put into effect. And we are praying maybe the next budget cycle they will consider improving sanitation budget so that our agents can go to the field and monitor, because if you don't monitor, you cannot tell what is happening.
That's a good one.